Hey guys, what's up? It's Dr. Thomas, and I'm talking today about the difference between direct primary care and concierge medicine. Because a lot of times people use these words interchangeably, but they're distinct and different. So I'll give you an example of what direct primary care typically looks like. Direct primary care is a membership model for healthcare, usually $10 a month up to $100 a month. And we use that $100 a month as a pretty firm cutoff. If you're charging over $100 a month for a membership in medicine, that kind of gets into the concierge medicine territory. So on the direct primary care side, fees are typically in the $10 a month to $100 a month. Now, at Plum Health, we do a membership starting at $10 a month for kids and $50 a month for adults. And then it goes up from there. In addition, direct primary care, you typically get the wholesale medications, at-cost labs, and at-cost imaging. You see, in direct primary care, I want to provide as much value as I can for my members. And so I try to save my members money by getting things at wholesale or at cost. I'm getting kind of group contracts for my members in my practice to save them money. You can't really say the same thing for concierge medicine. Concierge medicine, you're typically catering to like the 1% or the top income earners. And a lot of times they're price insensitive, so they don't really care how much they're paying for their meds, labs, or imaging. They just want the access and convenience. Doc, can you write me for an MRI? I'm going to go through with it through my insurance, and I'll get it at, even though it's $2,000 through my insurance and maybe $300 at cost, I don't really care. I just want to get it done. That's more like the concierge medicine side. Or, if you're taking lisinopril, I can wholesale that for like 35 cents in my DPC practice. Somebody who's in concierge medicine, they don't really care how much it costs, even if it's $5 to $10. It doesn't matter that they'd say $5 for $10 in the DPC model. They just want it when they want it. So that's like more of the concierge side of things. Also, this kind of speaks to the population that direct primary care serves. Direct primary care, I firmly believe that anybody with an income can afford direct primary care services. Like I said, $50 a month for an adult, $10 a month for a child. So when you look at a family of four, that's about $120 a month. I do a $10 discount when families sign up. So it's actually $110 a month. Versus the concierge model, it usually caters to the top 1%, or let's just say the top 5% of income earners. So people who are making $200,000, $300,000 a year, they're going to be paying that, $100, $200, $300 a month for this concierge medicine service. So let's talk about the typical price of a concierge medicine service. Usually it's in like the $2,000 a year range, or on up to like $5,000 a year. I've heard of some concierge medicine doctors charging like $10,000 a month. So that'd be like the super upper echelon. So at that point, you really only need to take care of like 5 or 10 people. And as a physician in the concierge medicine model, you can kind of make like $1 million a year. So that's a distinction too. DPC doctors, direct primary care doctors, were billing at like a $50 a month rate. So when we have 500-600 members, we're making $20,000 to $30,000 a month, or $200,000 to $300,000 a year after overhead. So we're kind of on par with our fee-for-service colleagues in the primary care space. Concierge medicine doctors, they're billing at the highest rate possible so they can have the highest income possible. So these are kind of the biggest differences in my mind between direct primary care and concierge medicine. Thanks so much for watching. Again, my name is Dr. Paul Thomas with Plum Health Direct Primary Care. We deliver affordable, accessible healthcare services in Detroit and beyond. And like I said, like our name implies, we're direct primary care. So we bill at that, $10 a month for kids, $49 a month for adults. And then we get folks the wholesale meds, at-cost labs, and at-cost imaging. And that really constitutes what it means to be a direct primary care doctor. I'm really trying to add as much value as I can for my members. And the only way that I make money is through my memberships. And that's through people saying that, yes, this is worth it for me to pay Dr. Thomas this $50 a month, or like $110 a month for a family of four. And that's how I make my money. It's just giving a lot of value. Where on the concierge medicine side, it's a really high fee for access to care. And by the way, one thing I forgot to mention is concierge medicine, a lot of times they're still billing insurance. So this is really like an access fee where you still have to have like a Blue Cross Blue Shield Platinum plan for these concierge doctors to take care of you, because they just want to bill everything through your plan and not have any headaches over any billing problems. Anyways, I kind of went back and forth on finishing this, but again, my name is Dr. Paul Thomas with Plum Health Direct Primary Care. Thank you so much for watching. I appreciate your time, and have a wonderful day.